The opioid epidemic in West Virginia has left an HIV outbreak in its wake, and it's particularly bad in Kanawha County.
So much so it's drawn national attention from the Centers for Disease Control. In tonight's special report, 13 News reporter Larissa Casillas spoke with local health providers about this outbreak within a pandemic and how we can slow it down.
Well, within the last year, there have been 11 new HIV cases in Kanawha County, bringing the total number of new cases to 60 over the past 3 years. Health providers on the front lines tell me it's not just a problem within an isolated demographic, but a problem within the entire community.
Christine Teague, director of the Ryan White CAMC program, gives me a rapid HIV test, one of thousands she's given.
Just a quick poke.
With the rapid test, results are ready in under 10 minutes. Mine is non-reactive or negative, but that's not always the case in Kanawha County. While it first came to national attention within the gay community in the 80s, it has since shifted into other demographics. Hemophiliacs like 11-year-old Ryan White, who contracted the virus through a blood transfusion, and pregnant women, sex workers, heterosexuals, and most recently in Kanawha County, IV drug users.
Prior to 2018, there had been less than 5 people contract HIV through drug use. In 2019, that number was 15. In 2020, that number was 37.
Now that it has gotten into a different group that's mainly being spread through blood transmission, the concern is that it could also now go back into other groups because we know that injecting drug users also have sex.
One Charleston resident we spoke with, who wants to remain anonymous, says the help he received changed his life.
I was real skinny and sickly looking, and I told them to test me for everything, and it came back that I had HIV. And then I was like, wow, you know what I mean? That's crazy. I never thought it would happen to me.
A longtime drug user.
You don't even think about the possibility of catching nothing. All you're worried about is getting that dope in your body.
The virus is now undetectable in his blood tests, and he wants his friends to know that help is out there.
There's so many resources for people that are sick like this.
The COVID-19 pandemic caused many health providers like West Virginia Health Right to put their HIV outreach efforts on hold. The pandemic didn't stop the HIV virus.
During COVID, people couldn't get into treatment centers. Treatment centers were on lockdown. You had a lot of people unemployed, but then we also had a lot of stimulus checks coming in. And then there was a lot of mental health issues.
As we come out of the pandemic, local HIV treatment and prevention programs are ramping up their HIV education and outreach efforts.
So the strategies of curbing the epidemic is getting to where the people are, getting them tested, getting them on meds, getting them to undetectable.
As the city of Charleston moved to outlaw clean needle exchange programs, the health providers are trying to push other prevention strategies like HIV PrEP medication, which when taken daily prevents the contraction of the virus altogether. The main challenge, however, continues to be spreading the message that help is out there.
They're diagnosed and they know that they have it, and offering them a ride right then and there to get on medication, and they refuse.
The experts will tell you that's the nature of addiction.
I've got myself together now, and I'm really proud of myself. I've never, came this far in my life.
In Charleston, Larissa Casillas, 13 News, working for you.